I was in the city. Pat drove up to Connecticut. He was in a wedding of two dear friends from Williams College, and I was here in New York. I was gonna get my hair done and then take the Metro North up. So I did that, and I started feeling these tightnesses. So I Googled nearest hospital. Uber shows up, I get in. 5 minutes later, I'm deposited in front of Stanford Hospital. We can't be here. We have to get to New York.
I got a phone call from Marina, and she says I'm at Stanford Hospital. And I hear in the background, oh my God, the heart rate's 50. And I'm in medical school, so I know that 50 for a baby is not good.
We're going into surgery, and the only thing I can do is just release myself to whatever the outcome's gonna be. Because it's probably gonna be bad. I'm losing a lot of blood, and our heart rate's going away.
I don't even know where I parked at the hospital, probably like on a patch of grass somewhere, ran into the hospital, and someone at the front desk yelled to me, are you the father?
Mom was feeling what we call a placental abruption, where the placenta was detaching from the uterus. And that is a very dangerous situation for both baby and mom. Faced with uncertain prognosis, the NICU can become a very terrifying area for parents.
This wasn't how it was supposed to happen, you know? You had this feeling like, this is awful.
We know this isn't what was planned. We know this isn't what you expect, but we want you to trust us.
Our team in the NICU is highly skilled, and it's really imperative to have such a team.
The family was in an unfamiliar situation, in an unfamiliar setting. We had tried to recognize things that we can do to help ease their concerns.
In the new hospital, we have a pediatric emergency department, which was the first in the area, and has elevated the care provided to children in a dramatic way.
It's not lost on us that parents entrust to us the most important person in their lives, and it's a tremendous responsibility, it's a tremendous privilege, and truthfully, it's why we walk through the doors here every single day.
By the time I woke up, I was back in the room where I started, and a sweet nurse told me that my baby was here and that my husband was with her.
Frannie was born premature at 31 weeks.
The nurses were so calming. They were like joyous that the baby was here and I was here, and I'm like, look at your beautiful baby.
So in those early days, I really felt that we had to be transferred to one of these fancy New York City hospitals. But it became very clear as the days went on and I spent more and more time in the NICU with her and with the staff, that there is no other place this girl could be. There's no other place we could be as a family than the Stanford Hospital NICU. We choreographed a lot of moving pieces in the rest of our life to make that happen, but it's the best choice we could have made for Frannie and for us.
But what made us decide to stay really was the staff. They're so caring and loving of their patients. It gave me a lot of solace.
It's a lot on a mother, it's a lot on a family, but Stanford Hospital ushers you into this new phase of life in such a warm, compassionate, loving way. And if I could do it all again, if I get the opportunity, I hope I can do it there.
Pediatric care at Stanford Health has developed some wonderful programs that have really been facilitated by construction of the new hospital. When people give to Stanford Health, it makes a difference. We get to care for our babies in a better way, and it really matters.
Stanford Hospital saved my life and saved my child's life and was able to give our family a beautiful start from a situation that could have been utterly tragic and devastating.
If I was going to say something to the whole staff at Stanford, it would be thank you. Thank you from the bottom of my heart.